Hi everyone, my name is Rachel Kirshner and I'm the Vice President of Insurance Services in Zillionople. Today I want to talk about Medicare basics. So what is Medicare? Medicare is a federal health insurance program. It does have four parts. You have your Part A, hospital, Part B, medical, Part C, which is referred to as a Medicare Advantage plan, and Part D, which is your prescription drug coverage. In order to qualify for Medicare, you either have to be 65 or older, be permanently and totally disabled for 2 years, or be diagnosed with end-stage renal disease. So let's get back to the parts of Medicare. So Part A, that is your hospital. That's going to cover inpatient, skilled nursing, home health care, and hospice. That's at no charge to you. As long as you or your spouse have worked 10 years, 40 quarters, and paid it in Medicare tax, you've already paid for it, so there's no monthly charge. The Part B, for most people, does cost $171.10 a month. If you're receiving a Social Security check, that will be automatically withdrawn from that. If you're not, they typically will bill you quarterly. So the Part B, what does that cover? That's going to be all of our outpatient services, so doctor visits, outpatient surgeries, blood work, x-rays, advanced imagings, preventive services, everything else that's medically necessary. Part C, that's the third one, that's the Medicare Advantage plan. As long as you have your A and B, you can enroll into a Medicare Advantage plan through a private insurance company. It technically replaces your Medicare. So you still do have to pay your Medicare premium, but your Medicare Advantage plan would be your sole, your primary, your only insurance. There is sometimes a premium there, and then there's copays and deductibles in the event that you have to use it. Most of them are network-based. They could be HMOs, PPOs. So you always want to make sure that not only are you aware of what your monthly premium is, your copays, your deductibles, but also that all your doctors and facilities that you go to accept that plan. Lastly, we have Part D. That's the prescription drug coverage. You can get this in two different forms. You can get it on a standalone basis, or you can get it included into your Medicare Advantage plan. And this is going to cover all your generic medication, brand medication, and this is offered through a private insurance company. Every prescription drug plan does have what's called a formulary list, which is a list of covered drugs. And this can change from year to year. So you always want to make sure every year that all of your medications that you take are covered through that plan, and that the plan that you're enrolling in is not only going to cover those drugs, but the best cost to you. They can have quantity limits, different requirements, prior authorization. It's a lot to do. And that's here what insurance services we can assist you with. That Medicare Advantage plan, or whether it be a Medigap, a Medicare supplement, a prescription drug plan. Our job is to make sure that you have the best plan for you. And it does, again, change from every year. So please give us a call, 724-452-2300. Again, like this page, subscribe, send us a message. We really want to make sure that we're just educating you as best as we can. But obviously, all these plans, we have to look at you on an individual basis. So we're just kind of, shooting this out to the internet to give some general information. But of course, an appointment to look at you on an individual basis is 100% necessary every year. So we look forward to hearing from you. And again, anything you guys want to hear about, any questions you have, please contact us. We'd just love to help you out. Have a nice day.